Hi, I'm Erin Merritt. I'm a principal scientist at MRIGlobal, and I'm here today to talk to you about COVID-19 and its effects on tuberculosis. Prior to the COVID-19 pandemic, Mycobacterium tuberculosis, the causative agent of tuberculosis, was the leading cause of death globally due to an infectious disease. In 2020, an estimated 10 million people contracted the disease and 1.5 million died from it. TB is a bacterial infection primarily transmitted by aerosol or droplet and can be spread when a person with active tuberculosis infection coughs, sneezes, laughs, or even talks. Because it is not prominent here in the United States, the Western viewpoint often forgets that tuberculosis exists, so it doesn't necessarily receive the attention, funding, or support proportionate with its global impact. When the pandemic hit, TB resources and funding that did exist were directed away from tuberculosis diagnosis and research. In addition, it also hampered months-long treatment regimens patients needed to recover from the infection. Though documented rates of infection for tuberculosis have dropped in recent years, dramatically so in 2020, that drop is attributed to multiple factors, including treatment and detection disruptions, failure to seek care, and is likely not a true reduction in incidence. In addition, due to COVID-19 shutdowns and distancing requirements, there was a drastically reduced volume of personal interactions which slowed the spread of TB. Tuberculosis is a disease that affects all aspects of a person's life and impacts their ability to work and lead a normal life. This drives entire families and communities into poverty, which in turn increases infection rates. That's why so many of us are passionate about helping eradicate this disease through our work with the National Institutes of Health and the Mycobacterium Tuberculosis Quality Assessment, or TBQA program that we help support. As a partner in this work, we evaluate TB technologies and specimen-specific protocols to be used in clinical investigations, research identification of antibiotic resistance mutations, and are conducting a longitudinal data monitoring study to evaluate clinical study data and look for trends or identify areas of improvement. Through the TBQA program, our goal is to help eradicate this public health crisis for people and the betterment of communities around the world.